A pleasant good afternoon to you, and welcome to our second edition of our program, Health Solutions Made Simple. That's the name of the program, Health Solutions Made Simple, brought to you by our brand, Health and Communication Solutions Limited. I'm your host, Carlton Lando. This afternoon, we are going to focus on an area that's extremely important to me as a pharmacist, and that is the topic polypharmacy. Polypharmacy. So that might be a term that might be a little ambiguous to you, particularly if you've never heard it before. But primarily, what it simply means is a patient who is on many medications. So poly means many. Pharmacy basically means refers to medication. So in lay term, it is a patient who is on multiple medications to treat or control chronic conditions. And we know that that is very common, particularly in the elderly, people who may be immunocompromised. So if your immune system is compromised, you may be one of the people that might be on multiple drugs. If you do suffer with different medical conditions, you might be on many different types of medications. And when we talk about polypharmacy, in spite of the prescription drugs that your doctor may prescribe to you, it also includes the over the counter medications that you might be taking, and as well the supplements that you might be taking too. So you might be saying, well, I am using a rub that is considered a medication. It is going to be absorbed when applied on the skin. You might be saying, well, I'm taking supplements. That's not necessarily inclusive. Yes, it is included. And so polypharmacy basically summarizes or includes all of these different types of medications that you might be using. So why are we so concerned about polypharmacy? One, any drug that enters the body alters the normal functioning of the body. So any drug, whether it's an eye drop, whether it's an ear drop, whether it's an injectable, whether it's a rub, whether it's something that you're going to insert in the rectum or the vagina, it will alter the normal functioning of the body. And so that means that the drug has to synthesize, it has to break down, it has to be metabolized. And so therefore, there are key organs that would definitely be linked to the breakdown of the drugs. So the liver is one of the organs. Your kidneys, they are also very much involved in breaking down drugs. The stomach is another organ that is very, very important in the metabolism or the breakdown of drugs. So if you are taking multiple medications, that means that these organs that have to work to break down these drugs every day or multiple times a day, these organs can be later compromised. So what can we do? What can you do if you are one of the people who are at home listening to me and you are taking multiple medications? So your mother, your grandfather, somebody that you know, they have a sack of medications at home at this time, and they may get them from multiple pharmacies, including that of the hospital or government pharmacy. So what do we do? Now, there are some issues that must come to light when we talk about polypharmacy. One is the brand names and generic names of medicines. So, for example, that patient may have Tylenol and may have paracetamol in another bag. That is the same medication, it's just two different brand names. So the active ingredient, which is acetaminophen, but it comes in two different brand names. So what we're concerned about is patient may be using the same medication but marketed in different brand names. So that is one of the concerns that we have. Two, literacy can this person read? Can they write? Do they understand how to take these medications? Because there's so many of them, and they may not be literate and do not know how and when to take these medicines. And so we have to be cognizant or aware of how educated the person is in terms of understanding the importance of the medication, what it's going to do, the right time to take it, XYZ. So that is one of the concerns. Affordability is another major concern. Can the patient afford these medicines? Are there cheaper alternatives that can be given? Are some of these medicines, can they be given in combination, meaning that some manufacturers may take 3 different medications, put them together, and make them under one pill or one whatever it is. So you would have one pill but 3 different active ingredients or 3 different medications in that one pill at the right dosage, all right, or the right strength. So that is another important option in terms of the combination of medications, making them more simplistic. The availability, are these medicines available for the patient? So yes, the prescription is written, but is it available? So if it's not available, then what happens then? Will the patient go back to the doctor to say, well, doc, this medicine is not available in Dominica or wherever it is that you are, what do I do? Or the patient would just say, you know what, I don't need the medicine, I don't care, I don't get it, and so therefore I can do without it. So this is another factor that we must definitely take into consideration. Side effects, which is really, really common. If you are taking multiple medications, then it predisposes you to more side effects. So you are more likely to get, whether it's constipation, dry mouth, dizziness, lightheadedness, depending on the medicine or medications that you're taking. Another concern that we have is drug-drug interactions, and that is very, very important because some of these drugs, they may be useful to control and treat your medical condition. However, they may interact with each other. Some of them may nullify the benefit of each other. Some of them may cause major reactions when combined together or taken together. Some of them may even put some of those very vital organs that I've spoken about even more at risk. And so when we talk about polypharmacy, all of these factors are very, very important. So it's not merely just seeing someone with a bag of medicine and just assuming, okay, there are 3 of them that I have to take in the morning, and you decide you're taking all 3 at one time. You're taking 4 in the afternoon of different drugs, and in the night you have to take 5 different ones. And what we see happening is that oftentimes people put all these drugs together in their hands or in the palm of their hands, and they just put in the mouth and swallow, not recognizing that some of these drugs should not be taken at the same time together. And another thing too that is very important is the timing of the drug. Some of these medicines may need to be taken on an empty stomach. Some of them maybe need to be taken with food. Some of them maybe need to be taken with specific food. So some drugs have to be taken with fatty foods. Some drugs should be taken with a fruit. So let's say you're taking iron tablets. It is best taken with a citrus fruit or a juice, a citrus juice, to help with the absorption of the iron. So all of these factors. Now the question is, when the pharmacist or the doctor narrates or gives the patient all of that information, can they digest the information? Can they understand the information? And at the same time, can they remember all of that information? And so what we recommend is that patients who are using multiple medications, maybe on 9 different medicines, 10 different medications, 12 different medications, 15 different medications, that you take all of these medicines to your doctor or to your pharmacist and you ask them politely if they can help you to sort out the medicines. Because as I said, there may be drugs that you're taking that are the same. So as I use the term, the example of the Tylenol being the same as paracetamol, the very same thing, you may have metformin, and when you went back to the pharmacy, they gave you glucophage. This is the same drug. It's just a brand name, two different names. And so if you're not aware, you may end up finding yourself in major problems. And so polypharmacy is important. It is one area in medicine that needs close monitoring, and at the same time too, education makes a massive difference. Once patients are empowered, once they are informed, and they understand the information that you've given to them, they can do better. And so I end today on this topic. Stay tuned for our third episode coming up very, very soon, later down this week. As always, we always say to you that Health and Communication Solutions, we are here to meet all of your needs, not merely just on health education and promotion, but we also meet your needs in terms of business. So we do product knowledge training, sales training, we do business plans. So we have an entire team of experts that works under our brand and would be able to help you. If you need further information, you can call us at 285, the number 285-3770. Again, have an awesome afternoon and continue to take care of yourself. Bye-bye.